Hi, my name is Cadie Phillips, and this is my vision board. A little bit of background about my career so far. I've been a registered nurse for 3 years, and I've worked in the emergency department for all 3 of those years. I work in a small critical access facility where we have 12 ER beds. On the top left corner are images depicting my professional goals. My goal is to work in the urgent care setting. In order to be better prepared for that environment, I am interested in obtaining a postmaster's certificate to become a certified emergency nurse practitioner. I am interested in working in urgent care for a great mix of fast-paced, diverse cases, better work-life balance in the ER, hopefully, varied hands-on skills such as lacerations and career stability in a growing field addressing primary care shortages, all while making a real difference in immediate patient needs. On the top left, there is a quote by Florence Nightingale that says, "Let us never consider ourselves finished nurses. We must be learning all of our lives." The field of nursing and medicine continues to be ever-changing, and this quote inspires nurses and myself to embrace ongoing training and to stay updated on evidence-based practice. On the top right corner are some images I have taken over the last few years. Self-care is important in maintaining a positive well-being. Some ways that I fill my cup include traveling, running, and spending time with friends and my dog Briar. The picture on the left was taken in Grand Teton National Park. The picture on the right was taken at a half marathon in DC that I ran last spring with my best friend. The bottom picture is of my dog Briar on a camping trip in West Virginia last summer. Finding time for self-care as an APRN means to me setting firm boundaries, prioritizing sleep and nutrition, scheduling dedicated time for physical activity, and leaning on my support system for help at work and at home. I think that when someone takes care of themselves, they are better capable of taking care of others. They are more likely to be better listeners and better at providing empathy. The bottom left corner of the vision board has a circle of caring model of advanced practice nursing. This model of practice is based on collecting subjective and objective data, diagnosing the problem, developing a plan, and evaluating the results. In a more circular approach, the APRN focuses on holistic care, such as the patient's meaning of illness, while encircling the whole process with caring. Some steps include assessing holistically, planning collaboratively with patients and families, evaluating patient perceptions, active listening, and patient empowerment. This continuous model allows feedback for improvement on the plan of care. This model promotes relationship-based care, leading to better engaged patients and improved health for the patient and the community. I plan on using this model in my practice due to the holistic nature of taking so many different aspects into consideration when treating a patient. In West Virginia, there can be a lot of barriers to healthcare and the patient's ability to start or complete a treatment plan. Through this model, I would be involving the patient and their family in the decision-making process and would take into consideration the patient's perspective of their own health. On the bottom right corner are pictures depicting APRN roles, such as being a patient advocate, a leader, an ethicist, and a policymaker. As an APRN, I intend to advocate for the patient and the community. An example would be advocating for access by addressing barriers such as financial issues, logistical problems such as transportation and long wait times, and personal factors such as health literacy, fear, and cultural beliefs. Another role as an APRN is a leader. I think that I most closely align with the servant leadership style. Key actions of this style of leadership are prioritizing patients' and coworkers' needs, active listening, empowering others, building strong relationships, leading by example, facilitating collaboration, and promoting well-being. Key ethical principles as an APRN include autonomy, beneficence, non-maleficence, justice, and compassion. To me, these principles can be practiced by respecting a patient's right to autonomy, acting in the patient's best interest, preventing harm, promoting equal distribution of resources, and showing empathy. An APRN as a policymaker uses clinical expertise and firsthand patient experience to shape health policy, advocating for better care, expanded access, and reduced disparities by influencing legislation, by joining boards, running for office, and collaborating with organizations. All of these APRN roles have a lot in common and are collectively aimed at promoting better patient outcomes.